Our group researched analgesics, and we're group analgesics 1. First, we'll start with the definition of analgesics. Analgesics are drugs whose primary purpose is pain relief. They work at the level of the nerves in one of two ways. They either block the signal from the peripheral nervous system, or they distort the interpretation by the central nervous system. There are 3 classes of analgesics. 1 is narcotics, 2 is nonsteroidal anti-inflammatory drugs, or for short NSAIDs, and acetaminophen. The first class is narcotics. The definition of narcotics: natural opioid drugs derived from the Asian poppy Papaver somniferus, or a synthetic form of the drug. Narcotics are used to dull pain and relieve anxiety before surgery. Some examples are morphine, codeine, a number of semi-synthetics including meperidine or Demerol, propoxyphene, Darvon, and others. Another class is nonsteroidal anti-inflammatory drugs, or NSAIDs. Nonsteroidal anti-inflammatory drugs are used to treat a wide variety of pain. They can be prescribed for relief of pain or inflammation, swelling, or stiffness. They can be acquired over the counter or by prescription. One over-the-counter example is ibuprofen. Some prescription examples are diclofenac, etodolac, and flurbiprofen. Another class is acetaminophen. The definition of acetaminophen: it's used to relieve many kinds of minor aches and pains. For example, headaches, muscle aches, backaches, etc.
Acute pain is a short-term pain. This can be caused from a headache, an injury, and even childbirth. Narcotics can be used to treat acute pain with little to no risk of addiction and ulcers. Pain lasting over 3 months is called chronic pain. This pain is severe enough to impair functions. Narcotics and NSAIDs can also be used to treat chronic pain. This increases the risk of addiction and ulcers. Even though we are in the 21st century, there are no new primary analgesics. Opium is the oldest painkiller. Originally, it was used in a religious context. As long ago as 900 BC, Homer wrote of opium in the Iliad, describing it as the bringer of sleep and forgetfulness. The Sumerians described it as the bringer of happiness and joy. The Hippocratic corpus, used between 800 and 400 BC, was a multi-herbal source of some 200 forms of pain relief. In 1591, Alpino wrote about opium addiction. Later, in 1644, Descartes made a link between pain and brain. Sir Christopher Wren began using intravenous opium in 1665. Ladies in Victoria times often used laudanum for their nerves. By 1917, morphine was produced. Reverend E. Stone started using willow bark in 1763. Salicin wasn't developed until 1829 by Leroux, and in 1877 salicylic acid was made. In 1899, Hoffman developed commercial aspirin, which has been produced by Bayer ever since. Salicylic acid is the active ingredient used in aspirin. It is known for its relationship with willow, but can also be found in wintergreen and meadowsweet. The other common analgesic, paracetamol, was developed in 1893. It was initially known as acetaminophen. It only became paracetamol in 1953 and is known as acetaminophen in the United States. Nowadays, there is a $20 billion market in analgesics. $400 billion are needed to treat side effects. Statistics from the Daily Telegraph suggest that 2,000 deaths per annum are due to aspirin alone.
All right, Henry Knowles Beecher, born 1904, died 1976. He was considered the godfather of modern analgesia. In 1946, he wrote about pain in men wounded in battle. He recommended in a paper published in the prestigious JAMA, or Journal of the American Medical Association, that the optimum dose of morphine should be 10 milligrams, 6 hourly muscularly post-op. He's set the scene for opiate use since then. Opiate receptors and spinal opiates. Since the mid 70s, scientists have uncovered information about endogenous opiate receptors, and in the 90s, it became possible to clone some of these receptors and genetically engineer mice with or without these receptors in order to study the effects of pain. Spinal opiates were first used as long ago as 1901. Katawal in Japan used intrathecal morphine, but it wasn't until animal work in the 70s that opiates were first introduced in humans as supplements to anesthetics. Spinal opiates. In 1979, Wang et al. Used selective spinal analgesia, and Bahar et al. Used epidural morphine. In 1985, combined local anesthetic and morphine was used by Rucci et al. In 1986, epidural spinal clonidine was introduced, and also epidural ketamine. And those last two drugs are not opiates. Okay, health effects. Although analgesics may help to control pain in the short term, with overuse or prolonged use, they can cause unpleasant side effects, which include nausea and vomiting, stomach ulcers, chronic headaches, decreased appetite, constipation or diarrhea, abdominal pain, kidney damage, aggravation of asthma, dizziness, skin rashes, tinnitus, and heartburn. All right, a little more on health effects. The type, number of, and intensity of negative effects will depend on the type of analgesic being used, the number of analgesics consumed, how long the analgesics are being used for, the health of the user, existing medical conditions, and whether other drugs are also being used. Here's some do's and don'ts for using analgesics. The do's: do drink lots of water. Do ask your doctor about side effects. Do visit your doctor if pain is still present. Do check the expiration date. And do use for only treating or alleviating pain. The don'ts: don't take analgesics on an empty stomach. Don't take analgesics with alcohol. Do not break or crush the pills. Don't take more than the recommended dose. And lastly, don't make it a habit of taking them.
Narcotic analgesic drugs. The term analgesic means non-narcotic analgesics. Non-narcotic These non-narcotic analgesics or non-opioids are used to treat NSAIDs, non-steroidal anti-inflammatory drugs. Prostaglandins are produced within the body cells by the enzyme. Non-steroidal anti-inflammatory drugs block the
Acetaminophen, or C8H9NO2, is a narcotic analgesic and antipyretic agent that is a clinically proven temporary relief for minor aches and pains, and it reduces fever and headaches. A narcotic analgesic and acetaminophen used together may provide better pain relief than either medicine used alone. In some cases, relief of pain may come with lower doses of each medicine.
Acetaminophen and non-steroidal. Next, we have here.
Another example of a nonsteroidal anti-inflammatory drug is methadone, with the chemical formula carbon 21, hydrogen 27, nitrogen, and oxygen. Methadone is a synthetic opioid analgesic that is primarily a mu-opioid agonist. It is used medically as a chronic pain medication and a maintenance therapy in people with opioid dependence. This pain medication was developed during World War II by the German chemists Bachmuel and Ehrhardt, and it reduces the withdrawal symptoms in people addicted to drugs such as heroin and morphine. Since everyone experiences pain, analgesics are not only available for humans, but for animals as well. Part of a veterinarian's duty is to relieve animal pain, and the proper choice of medication is crucial because the biggest challenge to the use of analgesics in animals is the determination of the efficacy of these agents. In humans, the verbal communication of the pain being relieved is fundamental to the effective use of analgesics. This helps to test and gather results for the pain-killing drugs on the patients. However, this differs in animals because the lack of verbal communication not only misperceives the analysis and characterization of the experience of pain, but also challenges the evaluation of the analgesic therapy itself. As animals possess the same neuron pathways and neurotransmitter receptors as humans, it seems reasonable to expect that their perceptions of painful stimuli will be similar, and so this becomes the basis for the use of lab animals for screening of analgesics. In this slide is a list of some common nonsteroidal anti-inflammatory drugs used in horses. The first, phenylbutazone, most commonly known as bute, has the chemical formula carbon 19, hydrogen 20, nitrogen 2, oxygen 2, is used for the short-term treatment of pain and fever in animals. It is extensively metabolized in horses and provides effective relief for horse arthritis or fracture injuries alongside generally painful joints. The second drug, flunixin, which has the chemical formula carbon 14, hydrogen 11, fluorine 3, nitrogen 2, oxygen 2, is a potent inhibitor of the enzyme cyclooxygenase and is mainly used for colic pain, muscle pain, and joint disease, as well as to alleviate fevers and pain and prevent endotoxemia, along with injuries in the eye. The third example, Equiox, which has the chemical formula carbon 17, hydrogen 20, oxygen 5, sulfur, comes in the form of an injection for the control of pain and inflammation associated with osteoarthritis in horses. Additionally, there is tramadol, which has the chemical formula carbon-16, hydrogen-25, nitrogen, oxygen-2, can also be used for pain relief in both dogs and cats. This is great because most non-steroidal anti-inflammatory drugs are dangerous for feline use, so this provides a nice choice for cats with chronic pain issues. And lastly, there is buprenorphine, known as Buprenex, and has the chemical formula carbon-29, hydrogen-41, nitrogen, oxygen-4, and it is an opioid considered approximately 30 times stronger than morphine, and it is the best used for mild to moderate pain in animals. One special medicine for animals is aspirin. Aspirin inhibits the enzyme cyclooxygenase that is involved in the production of inflammatory chemicals called prostaglandins. Arachidonic acid, a fatty acid that is essential in the diet of cats and dogs, makes up cell membranes, and when the inflammatory cascade is active, cells begin to convert their arachidonic acid into prostaglandins. Aspirin is the medicine that puts a stop to this and begins to aid for the pain in cats and dogs. And here is the best slide of all, our glorious We're Excited page. Hope that you enjoyed our presentation about analgesia.